Well, good morning, everyone. Today is Monday, April 14th, 2025. We are here for our second work session this morning, and our discussion item is, this is a work session for Behavioral Health Services to present the 2025 Impact Fund Grant Program recommendations. I'm Kristen Stevens, Chair of the Board of County Commissioners. With me on the phone is my fellow Commissioner Jody Shattuck McNally, and in person we have Commissioner John Kafalis. We have our County Manager Lorinda Volker. I will turn this over to Amy Martonis from our Director of Behavioral Health Services to talk about the program recommendations. So welcome, everyone. You can introduce yourselves as you speak, and we'll get started.
Good morning. Thank you for having us. I'm Amy Martonis. I serve as the Director of Behavioral Health Services, and I'm joined by my colleagues Jessica Plummer, our Impact Fund Grant Program Manager, and Madeline Novi, our Communications Specialist. We're glad to be here with you today to share updates on two key areas of our ongoing work related to community investments that are supported by sales tax dollars and allocated through the Impact Fund. When we met with you in February, we discussed the proposed administrative changes and improvements to the Impact Fund grant program for 2025. This included a pilot for grant renewals based on criteria that was developed through an analysis of 6 years of funding trends. Today, we'll briefly review that criteria again together and discuss how BHS is moving forward with implementing this pilot, along with how we'll continue to invite feedback throughout the upcoming grant cycle to inform continuous quality improvements. We'll also be providing an update on our progress towards developing a multi-year funding framework. Community stakeholders have consistently highlighted the need for longer-term funding cycles that enable deeper strategic change, along with the need for robust evaluation of both program-level outcomes and community-level outcomes. In response, we have been working to co-create a community-driven multi-year funding approach that not only supports long-term impact, but will ensure those evaluation efforts tell the broader community story that reflects how we're collectively improving behavioral health and well-being in our community and how these strategic investments are creating change. With this in mind, I'd like to invite my colleague, Jessica Plummer, to share more with you now.
Sure. Thank you, Amy, for the overview. So as you can see on these slides today, we have two things to talk about. Our goal for today's work session is to update you on the implementation and continuous improvement of the Impact Fund. So the first thing we're going to talk about is the administrative changes we're planning to implement for 2025, and this is based on direction that we sought back in February. So a snapshot, a review of that and what we're doing to move that forward at this point. And then also talking about our multi-year funding co-design process that we have for 2026. And I guess for those listening online, just a brief overview of the Impact Fund. In the past 6 years, that program has distributed $14.7 million to the community through 72 unique organizations. So again, when we were here in February, we had a lot of data. We showed a lot of slides with the analysis of the last 6 years of data trends. And a lot of that has also come through a lot of feedback surveys through our applicants, our reviewers, and our staff. And so these are the 5 changes we look to make for 2025. The first 3 are pretty straightforward, responding to feedback about having more time to review, so shifting up that timeline about 2 weeks. So we're ready to go this year and open up our grant program for May 13th. Closing it June 13th, which is a Friday, which is a shift from last year also because a lot of the feedback says we don't want a due date on Sunday. Everybody waits till the deadline, so they'd all prefer to have it done on Friday and enjoy their weekend, and us too. So the second one is increased flexibility in funding while maintaining good fiscal stewardship. So we know as the cost of everything keeps going up year over year, $1,000 can't buy you what it did several years ago, and so we want to be a little bit more flexible with our funding and be able to have folks be able to shift around some of the funds that they need while maintaining good fiscal stewardship. So these are program project specific funds, meaning they have to be spent on the thing that they applied for and that we approved. And so this just reduces some of the administrative work for our grantee partners for getting pre-approval for shifting around some of those dollar amounts, or if salaries change, there's some vacancies and things just need to move around a little bit. They have a little bit more flexibility, but we still encourage them to have open dialogue and contact us if they need to do any amendments as things come up throughout the grant cycle. The third thing is providing more support for budget and objective formats. And so what we've done this year, normally we do 2 webinars. We have 4 on our website now. We have our general overview of the Impact Fund Grant Program. And we've added 2 more, one specifically around financial documentation, all the uploads that need to happen to do our due diligence on financial reporting, and also talk about the budget and how they can use that. And then we have another workshop on objectives, so basically being able to succinctly convey what they're going to be doing with the grant dollars in a easy format for reviewers and for them to put in their proposal for everybody to understand. And so we have those 2 additional workshops in addition to the technical workshop that we do every year to help folks walk through the application itself, clicking the buttons, going through the grant portal. So we have that on our website, and we have that folks already registering for that, even though we haven't even opened the grant program. So we know that there's interest and people are on our website and go in there for that information. The 2 major things that we'll talk about are the major changes for this year is streamlining our grant requests to reduce partial awards by 50%. So again, some of those charts that we brought last time in February, we're talking about the 228 grants that we have. We had a cap of $250,000 in requests for funding, which was precedent was set in 2021 through a grant that was that large, but we really historically haven't been funding more than $150,000 the last 5 grant cycles. And that has also come down a little bit to close to $100,000 while also increasing kind of that minimum. So we're getting kind of a range between $25,000 and $100,000, and that's where most of the grants fall anyway. And so we want to make it clear to folks that are applying that we're going to cap it at $100,000. We have the number of applications every year keeps going up. We had 84 applications last year. We ended up granting about 41 grant awards, and about half of those were partial awards because we still had that higher cap of $250,000. And so about 70% of all the partial awards were because of that really high cap. And so we said, okay, well, if we reduce that, we're going to be able to reduce the amount of partial awards that we can do, which really is helpful for not only us, but our grantee partners, those that are applying, to set clear expectations about what we can fund and being able to fund what you're proposing in full instead of having to go back and redo some of those proposals when it comes time to contracting and have to redo some of their planning for the year. So hopefully that'll be a positive change and impact that folks will appreciate, in creating 4 budget tiers. So instead of applying for $41,628, we're going to keep it at $25, $50, $75, or $100. So we're going to be clear up front what we're going to fund. We're hopefully going to be able to fund all those in full, minus any outliers that are asking for things that we can't fund. We have a list of exclusions on our website, but they're pretty small. And then the last thing that we're going to talk about is addressing requests for sustainable funding and reduce workload by 20%. So what that means is, as Amy mentioned, creating a renewal criteria and streamlined process for organizations that have been partnering with us for the last 5 or 6 years. And so we'll talk about a little bit more in detail as we go through the next slides. So we brought this, since we met with you, we've actually met with our technical advisory committee, we've met with our consumer advisory committee, and we've met with our behavioral health policy council. And so we walked them through all this process, the things we're looking to do, these changes that we're looking to make, and this is the feedback we've had from all those groups. And it's really all positive feedback. They all really love the direction that we're heading in, not only just for this pilot for 2025, but also the plans we have moving forward for 2026. So some of that feedback is that this is a natural maturation of the process and the grant program. So moving forward from just kind of that annual award cycle to having some more deeper investments, like Amy said, in the community that are longer lasting. They like the continuous improvement efforts, great accountability for the sales and use tax. They appreciate the thoughtfulness behind these changes. They believe measuring outcomes is important, so that's something we're going to talk about too with some of the multi-year funding efforts that'll be happening, considering for 2026. And then some of the other thoughts and feedback they had were several considerations for communication. So be clear about how much of the $2.8 million is going towards renewals and the competitive pool of funding. So right now with the renewals, and they'll be on the next slide or two, about half the portfolio, we're going to open up for some of those renewals, which are some of our bigger grants anyway, and the longest lasting that have been funded for the past 5 years. So we're going to share the why behind that. Madeline's here. She's going to talk about some of our communication strategy around that. And we spent a lot of time updating our website, creating a communications plan to reach out to not only folks that are eligible for renewal, but folks that are applying or people that have applied in the past to explain some of the process and the changes. And so we're hopeful that there will be a smooth transition for this year for some of those things, but also we have a long on-ramp for 2026 and any changes that we make to keep our stakeholders informed along the way. So where are we in this implementation progress? Right now, our grant portal and our application changes are updated for this grant cycle, so we made some small tweaks to that. We've also created a smaller renewal application for those renewals, and those are ready to go in our grant portal. We've created updated supporting documentation for everything that folks need to apply for this year based on feedback. We always do a retrospective at the end of each year, considering all the feedback and implementing that in the next year's funding cycle. Our website's currently being updated and is, I believe, ready to go. And our email notifications are drafted and scheduled to go out. So hopefully after we have our conversation today and we receive any other additional comments or feedback, we have time to make any last-minute changes that we may or may not need to make before we can start reaching out to some of these organizations and start opening our grant program in the next month. We'd like to start sending out email notifications to let folks know that it's open, it's coming. We call it the soft launch so that folks are notified. They have a month before the application period opens, and then it doesn't close till June. So getting into the detail of the renewal criteria, this is something we showed you in February. Nothing has changed. It's just reviewing that again. For those that are listening also online that might be curious, so those organizations that are eligible for this renewal process must be a current, and by current I mean 2024 grantee that we awarded last year. They're a current grantee with us. They've received and effectively managed 5 or more grants from Behavioral Health Services. So what that means is that in what we call pre-award and post-award, when they're applying as an applicant, reviewers continue to prioritize these for funding. So if they've been a grantee with us for 5 years, they've probably had a dozen or so more reviewers, and each year they continue to be prioritized for funding out of a really competitive pool, which indicates to us that they're doing something right in the community. They're filling a gap or a need that people feel like Behavioral Health Services dollars should support. And then on the post-award side, they consistently meet reporting requirements, their objectives. They do what they say they're going to do, and they can meet all of our insurance requirements, reporting requirements, financial, good stewards of our sales tax dollars, and are showing outcomes over time. And so the third one is, the program project that we're funding is generally ongoing because usually can't solve a problem within 1 year. They've submitted at least 4 final reports. They're demonstrating efficacy and can show impact over time, and that's something that we're going to try and capture with this new renewal process, is really how those funds have impacted those organizations over the past 5 or so grant cycles. So if we apply this renewal criteria, those 3 things, and keeping funding levels relatively the same as what we funded in the past, that equates to about $1.4 million being distributed through our grant program this year for about 15 grants. And as part of our advisory committee work, one of the goals they had set for this funding and that portfolio of money is to make sure that at least 70% would go to our targeted project areas. And those are our concentrated areas of focus funding that have been developed by our advisory groups for the past, they were established in 2021 and have been revised by those groups for the past few years. And so 88% would go to those targeted project areas and reduce reviewer workload by at least 18% or 90 hours. So like I said, we had 84 grant applications last year. When we look at all the folks that are involved in the process, we have 3 external grant reviewers per application, plus our staff, plus our advisory groups, leadership. When you look at all those people that are involved, it's about 6 hours of work we estimated per application. And so when we think if we're taking 15 applications and doing the streamlined process, we're probably saving about 90 hours of time. And then as part of the renewal process, we're also going to survey our grantees to ask what are the benefits of this streamlined process and what time have they saved overall too, because I think when we factor that in, it's going to be a lot of time savings for everybody. So what we're recommending for our renewal notice is doing that. We had proposed April and May, but we're thinking we can roll that out this week and start reaching out to organizations that are renewal eligible. And we want to talk with them to discuss any anticipated changes. So we're going to do our due diligence to make sure that we're asking about, has anything changed between last year and this year? Is the program mainly staying the same? Has the leadership changed or the strategic direction of the organization? We're still going to require updated financials. We do that for all of our grantees as part of our financial due diligence process. And we'll have an updated one-year budget and objectives. And we have drafted, I've worked with Madeline to draft, maybe 6 or so questions to reflect the long-term impacts of the funding, to help her tell the story of what the impacts of these dollars have been for the past 5 grant cycles. So we're really excited to have that and have that be the focus moving forward, is really the storytelling of the impacts that are having through these organizations and through this funding. And then we're also going to survey, again, time saved and other benefits. So with that, maybe I'll kick it off to Madeline for a moment.
Hi, I'm Madeline Novi, Communications Specialist with Larimer County Behavioral Health Services. As Jessica said, if you all are okay with the approach, and we'll certainly take any feedback you have around information that would be important to communicate, anticipated questions, things like that, we would be happy to hear those. But our plan is to start communicating tomorrow, if that is determined to be appropriate, starting again with those organizations that are meet that eligible criteria for renewal. And then shortly after, go out to the list of past and current grant applicants, so that they're in pretty quick order, so that as news of the renewal process goes out, that we have folks also getting information about the typical competitive process going out as well. And so we know those folks are very interconnected, and we want them all to have the same information at about the same time, so that they know which of those categories they would fit into as they're considering being part of the Impact Fund grant program. We will also have resources. My plan is to send out information to you all so that you have copies of those communications and know what is going out to whom and when, along with a frequently asked questions guide, so that may help you if you are getting questions about why we're going in this direction or what's to come. How much is going to the organizations that are renewal eligible versus how much is available to all organizations to apply for, anticipating questions of that nature. The other thing we'll post on, of course, our websites, working with Tom in Public Affairs to post on the county website, and then sharing out with our media partners to broadly distribute the information as we have in years past, and then partnering with our advisory groups to spread the word. One of the things that Jessica mentioned that we're really excited for is that opportunity to continue quantifying the impact of the investment of these dollars. So in front of you there, I've shared a copy of our annual report, which I've also shared digitally. And we've started working through how to tell the stories behind these dollars and show people, some of the people within our community who have benefited from those most directly. So you'll see just some very short snippets of 4 stories there on the page that highlights the Impact Fund grant program. But if folks use that QR code or go to the Behavioral Health Services webpage, we have more stories on there that highlight the data sharing project, the Larimer Integrated Network of Care, or LINK project, that's multiple organizations are working on to provide better care. We have a story of the first client at our acute care facility at Longview campus. Stefan has very graciously shared his story in the hopes of helping somebody else who is struggling with substance use disorder, and his path to recovery. Features on individuals who their positions have been made possible because of Impact Fund grant dollars, launching their careers into behavioral health within this community, and then having a full circle effect on where they're at today. And so as we move forward with the renewal program, I'm very interested through partnership with Jessica to work with our organizations to have them share both quantitative and qualitative data to understand how many people have they touched through these dollars, but also what are some of the stories and faces behind that work, so that we can continue being really visible and transparent with our community about where their dollars are going. And so we're pretty excited for the next phase of this work. And with that, if you have any questions or feedback around the plan or communications moving forward, we'll be happy to take them.
Commissioner Cavallos, any questions?
Yes, I'll offer one question at this time. And I think overall the annual report looks great. And my question, well, I guess there are two questions, forgive me. One is, in terms of communications and qualitative, quantitative information, is there a way to make the case or share the story how we've seen a rather significant decrease in suicides in Larimer County, and people have suggested that the acute care facility and other kinds of, the investments in the community are at least a contributing factor. Therefore, my question is there a way to properly show that potential correlation? And is that part of your plan?
Yeah, thank you for the question,
Would you
Commissioner.
mind talking a little bit closer to the mic?
Yes.
Ms. Madeline Novi?
Better?
Yes, ma'am.
All right, thank you. Great question, Commissioner. So as we move forward into May, it is Mental Health Awareness Month. And so I have partnered with some communications folks from across the county, from Health and Human Services, from Larimer County Sheriff's Office, from HR and others, to put together content for every day of the month, showcasing resources in our community, as well as one of the planned pieces that I have is to look at the work of the group in the county that is tracking the suicide rate within Larimer County, and to look at some of the work that's been done over the past several years, so the Suicide Fatality Review Board. And so I have connected with Dr. Jared Olson in the Larimer County Department of Health and Environment to understand the data better and to find the best way to tell that story. As you know, causation is very difficult to show, but what I think we can accurately say is that there was a decrease in our suicide rate in Larimer County in 2023, and that the continued efforts of all of these different organizations, whether it's the Alliance for Suicide Prevention, whether it is the acute care facility and the direct intervention that they can provide, the work of in the schools to provide education, many organizations doing mental health first aid and question, persuade, response, QPR training, all of those things collectively, I think we are seeing the impact of. And so I think our message is that is a success, and every single number is a human being and a life saved. And sometimes that may go up and sometimes that may go down outside of the control of any one organization or municipality. But the fact of the matter is, here in Larimer County, we have people who are paying attention to it, looking at evidence-based practices, and figuring out how to actually work together to create systems that can help change lives and save lives. So thank you.
May I do a quick follow-up? Thank you. And it reminds me, I think there's been at least one newspaper story, I don't know if it was the Colorado Sun or one of those, that highlighted this collaborative work and how it is likely contributing to some of these reductions in suicide. So I would assume or hope that there's a way to elevate those kinds of news stories so people can have access to that. My follow-up question, I think I know the answer, but I'll check. And that is, when you mentioned our population epidemiologist, yes, I assume that there is a cross-referencing of the two data dashboards, the Behavioral Health Services data dashboard and the Health and Environment data dashboard of Community Health and Well-Being. Those are cross-referenced, are they not?
So I believe the behavioral health data dashboard now lives on that
Oh, really?
community, resiliency dashboard. So they were merged maybe a year or two ago, I'd say. So they all live in there.
I hope,
And they are, we work closely with
I hope they're
Dr.
happy
Olson.
living together.
Yeah.
Thank you, Madam Chair.
Yeah.
I
And I
that's all
think-
for now. I have something for later.
And if I may add something else to what Jessica shared, Dr. Jared Olson he attends as well the meetings of the Quality Outcome Committee for Longview. So in sitting together with all of those individuals and evaluating who is coming to Longview, what they are being seen for, how the services are being provided, and all of the outcomes that they are tracking, he is also sitting in on those meetings with that intentionality of making sure that the data are most accurate and to identify what impact they're having on our emergency rooms, on our law enforcement officials, and the data that he keeps there on that dashboard.
Thank you. Commissioner Shattuck McNally, any questions or comments?
Yeah, thank you, Madam Chair. I first want to just say thank you to Madeline and Jessica and Amy and the whole Behavioral Health Services team. We've been attending a lot of meetings together with the Policy Council and the two advisory councils, and it's been really some great discussions. I wanted to make of note to comment to my colleagues. As chair of the Policy Council, we have had a pretty active and fully attending Policy Council. All the municipalities who are assigned to be at the council meetings have been attending, including Johnstown, Windsor, Tennessee, Wellington. It's been really great to have all those voices, and a lot of them are new, but they bring some great feedback and some information. So, and a lot of the folks in the room who have been part of these conversations are also grantee award winners for previous years, so they have had some feedback. And so I think that's really been great for the conversation at this point as we look to transition to, as the slide said, I remember when that was said in the room, the natural maturation of this process, which I've been following closely since 2019. And so I think this is really important for also data collection and following and making sure we're accountable and transparent to our taxpayers who graciously and voted for this sales tax, and we could not be doing the work. We could not be saving lives as we are, and appreciate all the work that staff put into this and really communicating with folks boots on the ground. I wanted, Commissioner Cabal should represent that article. Actually, it was me talking with Nick Coltrane, who happened to be in an event I was last fall, and he came and interviewed a bunch of folks, including me, and we had lots of discussions last fall, and that led to that article, which I talked with him about one-on-one and face-to-face on Friday, and he plans on a follow-up. He's certainly interested in our one-year anniversary and some of the changes at the Longview Center, and so he's going to get in touch with me as he wants to be made aware of that opportunity to come and see some of the new changes. So there should be more to come with that. I wanted to say, a lot of folks that was mentioned as part of helping with all of the decrease in suicide rate and also substance abuse overdoses. Excuse me. I could go through. I've started to do my own little graphing thing about what certain nonprofits have, how much money they've received over the years. So a lot of the folks that have been very vocal and very upfront and working with the Larimer County Behavioral Health Services team are also people who have benefited from the impact dollars. And so I believe, and I'm sure they would say the same thing, that their ability to increase access, intervention, and to engage more in the community has been a big part of having that impact grant funds. So I think there's a lot of win-win here, and I hope that everyone sees that everyone involved, everyone should celebrate and high five. Everyone deserves credit with all this because it's something that we can't do in silos, has to be done together. I sit and attend the Suicide Fatality Review Board. It's not really a board, it's just kind of a group, a loosely group, but there are some MOUs and stuff, and really grateful that we have someone like Dr. Jared Olson who is helping us bring all that data and put it out on the dashboard, including some of the research and information to help with the Regional Opioid Abatement Council. And we have been using the Butler Center for Research at DU to help us come up with some metrics and try to help how we are handing out those abatement money from the pharmaceutical settlements to help with this area as well, which is overlapping and is working in kind of tandem with what we're doing as behavioral health services. So this is, I think, a great process and step. I know a lot of people like kind of those grant limits of the 50, 35, and so on. It makes it very clear. And I think overall, the other big point is this will reduce staff capacity, or the need for staff capacity, because it does take so much to wrangle all this. And I know our dedicated scores of the applications are spending a lot of time thoughtfully reflecting on all these applications. So this is a lot of positive in this new process, kind of refining it and making it more data-driven than it was. It always has been data-driven, but even more so now. And I just want to commend the team for the work that they do together and the work they work with our partners to really maximize every single dollar that we get from taxpayers to save lives and help folks on the path for holistic health in so many areas. Thank you so much.
Thank you, Commissioner. I'll just ask one question, and then we can move on. But has there been any pushback, or because we're kind of just rolling this out, on the idea that there'll be, these multi-year awards, and that half the dollars will go to some of those folks? I mean, is there anyone saying we wish there were more competitive funds? We don't like the process. I don't know what the outreach to those nonprofits has looked like.
Yeah, I appreciate the question, and we look forward to having more conversations with our partners that have participated in the grant program in the past. This has gone forward through our advisor groups and the Policy Council, but our external communications to community partners will begin this week. So we'll keep close tabs on that and report back and share with you how the conversation continues to evolve. And I feel like we have a thoughtful strategy and approach in communicating the why and sharing out some of the data and strategy that informed this direction. So those conversations will be underway.
And is that the information, Madeline, you said you would get to us around, having those talking points in case any of that rises to our level?
Yeah, yes, Commissioner. My intention is to share copies of the emails that will go out to those who are grant renewal eligible, as well as those who would be part of the typical competitive process. And then we've developed, you can either call them frequently asked questions or anticipated questions, responses to those. And that is one of the questions that we have in there. I think the response that we have in there is something to the effect of, we understand certainly that there is a desire that there are more dollars in this fund. I think we all do. And that's something that I think we'd like to be able to grow over time. And at this point, we have the 2.8 million. And the strategy behind it, as Jessica said, is evaluating the past 6 grant cycles. There are organizations that have demonstrated a positive effect in the community over time, and that they have the data to show that. And so our goal will be, we don't want to stop some of that good work that is showing demonstrated positive impact, but we also want to be able to maintain dollars that are available to any organization, including those that may be new or emerging in our community, to be able to meet the needs in ways that may be different, right? So part of the Impact Fund grant program, the beauty of it is that we have an opportunity to invest in things that maybe haven't been done before in the behavioral health space, to be able to reach people in ways that we have not done in a traditional private practice kind of setting. And so there will be continuing work that has helped people within our community, but then also continue investing in some of these more innovative and different things. And then in time, I think we would all love to see that increase. But for now, that's the approach. And then it dovetails into what's next in our presentation around how do we grow our long-term investment strategy. So we have the short term, we have the kind of midterm, which is the pilot of this renewal program, to see how we can continue really maximizing, as Commissioner Sheddick McNally said, every dollar, and then how do we leverage that into really identifying the greatest needs in our community, going deeper on what we already know is a priority, and then how do we foster collaboration among organizations to really take a look at and provide solutions. So I think that's a great way to segue into what we have next for you all.
Sounds great. Let's do that.
Commissioner, can I add
Yes,
just
of
one
course.
thing there? Because these are sales tax funds, we're also monitoring what the economy is doing. And so we know last year we didn't see a tremendous growth in sales tax. So the fund is there, it does support services, but there are limited funds really to put toward these grants as much as we would like them to be unlimited. And the question I had was similar to yours, and that is, it is likely that an organization that does not get designated as eligible for renewal might reach out to a commissioner and ask them to get engaged. The process I imagine you would like is for those to be forwarded to you, and you would contact those directly, those organizations directly?
Yes.
Okay.
Yes,
I want
thank
to
you.
be really clear about that because this is a change and they have not been involved directly as stakeholders, although you've not been secret about it. We had a February work session that's been talked about in 2 public meetings with our advisory groups, a third with our policy group. And so this is certainly out there, but I imagine there'll be folks who will be disappointed not to be considered a renewing agency.
Yeah, certainly, and we would welcome those follow-up conversations and recognize that with this pilot that takes a step towards developing a multi-year funding strategy, all of the feedback will come back to BHS and be part of our strategy moving forward. And so we recognize anytime there's data-driven or emerging change, that there will be unanticipated or unforeseen areas of feedback that we will hold, consider, and incorporate into how our funding strategy continues to develop and evolve. Thank you.
Great. Well, let's look ahead to 2026.
Yeah. Okay. So shifting gears just a little bit. So we've mostly been talking about, the first item on our agenda today, which was this pilot for 2025. This is looking ahead at multi-year funding, what we have coming forward in 2026. And at the top, you'll see it's the 2024 work product in action. So we're kind of spanning a few years here, but bear with us. This was the work product that came from our advisory groups last year that we weren't able to implement at the time as we were getting Longview up and running. We kind of just put a pause on this a little bit, also with some leadership changes. But we've taken all that feedback from our advisory groups, and we want to honor that and start incorporating that into our plans moving forward for this kind of multi-tier investment strategy with just some of the smaller grants, kind of like you said, that medium term and some of the longer term investments. And so what came out of that 2024 work product was talking about long-term multi-year funding strategies. And the biggest one that came up was encourage collaboration over competition. And so what we have decided to do to honor that and move forward and take that feedback is move into a co-design process. So for the next 6 months to a year, we've actually put out an RFQ, a request for quote, back in February to get an organization on board to help us facilitate this process so that we have kind of a external entity helping to facilitate not only the conversations with our stakeholders or grantees or other folks in the community about where that funding should really go for those deeper investments, longer term investments in the community, but also support those organizations moving forward in data and evaluation. So if you can see, they're going to help us make that co-design framework. And so the 3 other things that those advisory groups said that they really wanted was support for program evaluation, making sure the programs we are investing in are effective and showing impact over time. Like you said, the qualitative and the quantitative aspects of that. And that could be from the program level, the organization level, or maybe up to some of those community level indicators. Like how do we connect those dots like you were asking about? The correlation, maybe not the causation, but how do all that collective impact kind of raise up and kind of connect to our community health improvement plan, our community master plan 2.0 that we have. And so some of the other group members said they want to emphasize improving access to services and the value of care to vulnerable communities. So how we're going to focus maybe on that for some longer term funding initiatives. And then again, continue to improve data and reporting for longer term investments. So bringing that organization on board, like I said, we did this RFQ process in February. It closed in March. We had 15 really great organizations apply and really competitive proposals. We narrowed that down to 5, and then down to 3, and then down to 2. And we're actually in the contracting process with one right now, so we should have that organization hopefully on board in the next week or so. I'm really excited to bring that partner on board. We've had a vacancy for our data and evaluation person on our team for maybe a year or so, so this is going to bring a lot more capacity to our 5-member team. We're a small department, but we do a lot. So excited to have that group on board and be able to engage with our community in a different and unique way. I think the vendor that we selected has some really unique attributes that we're excited about having on board. So yeah, really wanted to be able to, again, communicate that story of impact with some of those metrics that they'll hopefully help us design as well. So we're calling it the co-design process, and if we kind of look at the year, what we have going on, we're kind of in that pre-design phase right now where we're kind of going through this process of vetting and approval, vendor selection, and then hopefully when we get them on board, we're going to be starting to talk about participant and facilitator recruitment strategy, so who we're going to get on board when. Like I said, we're hopefully going to have 6 meetings in the next 5 or 6 months or so and have an update maybe in September or October, have this framework filled out so we can come back to the this group maybe in the fall with an update. I think we can probably update you on progress in August when we generally do our impact fund grant recommendations for those that we're recommending for the year. And so we'll have some progress updates probably in August, but might need a separate session in the fall. And then hopefully put out an RFP process for some of these deeper, longer term investments opportunities. And then hopefully that can inform some of the work sessions that we have, again, with our advisory groups next spring. So they meet January, February, March, and we present again in April. So hopefully this process will dovetail really nicely into kind of that next session and what we're going to do and have some more community involvement with those groups, talking to the whatever ends up shaking out as being prioritized for funding for these dollars for multi-year investments. So that's, yeah, May through October, and then October through December. All right, kind of touched on that post-design aspect, and then it'll inform our roadmap for 2026. Some of the things that we're considering is, and that we're going to be working with this vendor on, is how our department will be allocating the $2.8 million each year for these short, medium, and long-term investments. How will longer-term investments support program evaluation? Again, the data and evaluation pieces and any sustainability planning. If we're looking to invest in something for several years, what's going to be our role in helping to leverage other funding sources to keep it maintained beyond? We know the sales tax dollars hopefully will renew, but we want to be sustainable and good stewards of these sales tax dollars and leveraging other funds as well. How will BHS communicate these changes to stakeholders? I think we've had a lot of conversation and dialogue about that. Madeline's joined our team in December, has been rocking and rolling on communication strategy, so really lucky and happy to have her on board and kind of leading those efforts. And then how will BHS set clear expectations about length of funding? I think that's always been a big question mark, is how long do we want to fund something? If it's continuing to provide the services and the needs in the community and filling gaps, why would we stop funding them? But like Madeline said, there's other things that arise that come up and you just need to make room for. So sometimes organizations don't get funded or don't get prioritized at some point. It doesn't mean that they're not doing great work in the community. It's just that these dollars need to be invested in other ways. And so wanting to make that clear and for our partners and for those that are applying on our website and things like that. So if there's any other considerations that we don't have on here, I guess there's an opportunity for any feedback on things that we should be considering. And I can pause there and just see if there's any questions.
Any questions, Commissioner? Commissioner Kavalos, please go ahead.
Thank you. I have 3 questions, comments. One is, I think regarding this slide and other considerations, with the understanding that the $2.8 million has been kind of set over the last few years for very specific and logical reasons, is there any consideration to increase that amount in the future in order to perhaps accommodate the fact that we like most grant dollars, there are more applicants than resources? That's my first question.
Yes, and I think Amy wants to take that. Go ahead.
This is one of my thoughtful questions, Ms. Martonis.
I appreciate the question, and it's something that BHS continues to evaluate year over year. And we were not seeking an increase in this year with awareness of what's happening in the wider economy and what's happening with the sales tax revenue that we're seeing that is available. We're also continuing to assess and look at Longview sustainability, and a significant investment is made in sustaining operations at Longview. And as that operation becomes more self-sufficient and there's more revenue share, maybe that will create an opportunity to invest deeper or differently through the impact fund or multi-year funding. So it's a question. I think it's a shared hope, and that we'll look at several factors in bringing forward a recommendation back to the board around any changes on the horizon in the future.
Thank you. May I do two more real quick? Sure. In the, given that one of our guiding principles as a county is being good fiscal stewards, the sales and use tax revenue that we're generating, that we're monitoring very carefully, how are we spending that money? 2.8 is going for the impact fund grants. 25 million went to build the facility, and that's done. And we are receiving more Medicaid reimbursements. So, and why I bring that up is, I think it's still paying for operations, but I'm wondering if we're able to set aside reserves, to prepare for future, even additional uncertainties than we have today.
Yes, that's a great question. I appreciate it. We do maintain some reserve right now, currently about 23 million. And I'd offer an awareness that as we thought about and wanted to respond to the community need around adolescent services, originally some of that funding was earmarked for a separate facility. And in wanting to be fiscally judicious and cautious, the decision was made to make some minor changes at Longview to use existing facilities to roll out those services. So those changes at Longview are anticipated this summer, that expansion of youth services, but not a separate capital project or building project to enable that, which is what's supporting us having some reserve to be judicious and thoughtful in other strategic investment opportunities as we look forward.
Thank you, Amy. And that's a wonderful segue to my last question, which I think you've partially answered. Can you be more specific about the update regarding the adolescent unit? It says summer 2025. Summertime begins June 21st and it goes till September. When?
Yeah, that's a great question. So our collaboration with facilities and the process of the architectural design, my understanding is that permits have been filed. We reached out for an update on timing just this morning, in fact. We are anticipating a soft launch this summer of adolescent services, and we are looking forward to hosting an open house and a community celebration of those services with a date we hope to have set by the end of April. We want to align that with construction timelines and permitting processes that are still somewhat unknown, but we're getting closer and still anticipate a launch this summer for those services.
So I'll add, it's complicated because these are youth in a facility that also houses adults, and so there are very specific
licensing.
Barriers that have to be put in place that weren't contemplated when the building was first constructed. So getting that right the first time so that we don't have to go back and do it again is really critical. So you all are working with all the right agencies to make sure that that happens, and we do this just the one time.
And we are looking forward to, I plan to be back for a work session prior to adolescent services opening to specifically highlight that and talk in much more detail about that expansion.
Thank you, and I don't want to forget this time. Appreciate so much the excellent work that the Behavioral Health Services team is undertaking. Certainly a shout out to our Human and Economic Health Director, and working closely with facilities and all the other leadership folks to really provide a valuable service to our community. So thank you. And I made an observation on the annual report that I will share with you offline.
Thank you, Commissioner. Commissioner Shattuck McNally, any questions or comments?
I'm good.
Nope. I think I spoke quite. Look forward to seeing how this progresses. Appreciate everyone.
Thank you, Commissioner. Yeah, I just want to extend my thanks for the work that you're doing here, and I appreciate the thoughtfulness around this grant process, right? I mean, I want to make it manageable for the people who are looking at all 84 grant applications. It also makes sense to really fund programs that are successful and that are doing a good job and that are fundamental to community mental health and behavioral health. So I like this, and I like, the idea of looking at this in the future, seeing how it goes. We'll certainly give you feedback if we hear feedback, because that often comes to us. But, yeah, I mean, I think that there's still a lot to be decided on what happens, but I think, I like the trajectory that we're on. I think that, this is great work. I've seen a lot of the social media stuff, Madeline, so I appreciate that there's stories in there, and I think that stories were so integral to passing this tax, and they're integral for people to understand, how this work is being done, and I think that that's such a great touch point. We can give a lot of statistics, and ultimately people want to know, are people being helped, and who's being helped, and what kind of help are they getting, and would I get that same kind of help if I went there too? So I think that piece is really important as we move forward. But, I appreciate all this. Lorinda, any comments before we close out today?
I guess just to package it all together, this really is a bridge year going forward based on this RFQ and the vendor that gets hired. There are organizations that are competing in a grant process that we know are offering really valuable services, and that sort of felt disingenuous to have them compete against new services that are innovative and those kind of things. And so to be really clear about that, I think, is one of the real reasons. It does reduce workload, it does create clarity, but it also creates an expectation of how much money is really left for the non-renewing grant applications. And then going forward, there are those things that have just become so valuable in our community that have been funded through this that maybe they should be more formally approved for funding rather than having to compete or be considered a grant. Much like Human Services does an RFP for services for local counseling services for their participants, it felt like maybe this is the right time to start having those conversations. What really are those things that need sustainable funding, where they can hire a staff member or really make a long-term plan, not year-by-year planning. It wasn't really fair to the folks we're funding as well, and the services they're providing really are being well utilized and counted on, have great metrics, and are renewed for a good reason. And so I don't want folks to feel like this is a matter of favoritism or these are people we've just worked with longer. These really are outcome-based organizations that have provided a foundational service to our community. And I hope folks understand that. There'll be those on the bubble who feel like maybe they should have been included. We still want them to compete. This is still a very valuable process. And we hope that in 2026, with the use of this vendor, we'll get really a clear program around this. We can talk about early and often, so it won't feel like another bridge year. It'll be really clear going forward. This is a long-term sustainable program that we're trying to build, and I think this is the next evolution of that. And you all have shown great leadership in how do we get there in a somewhat painful process, but less painful than had we just announced the new criteria without all of this stakeholder engagement. So yeah, thank you for what you've done. I know it's not been easy, and it won't be an easy year because of the changes. 26 will also be difficult, but I think you're on the right path to make really a predictable funding strategy for our community.
Thank you, Lorinda. Well said. All right. Anything else before we close out this? Well, it is 11:56, and we will adjourn, and we'll look forward to further conversations. Thank you.